and welcome to the first maternity episode of our Epworth Live series. Today we're joined by neonatal paediatrician Dr. John Mills, who's going to chat with us about the fourth trimester. If you have any questions for John, please feel free to pop them in a comment below and we'll respond to you as soon as possible. The first few weeks as a new parent can be tough, and we'd like to acknowledge that it's Panda Week, all about reducing the stigma around perinatal anxiety and depression. This year's theme is I Wish I Knew, and I think some of your answers to the questions today might touch on that idea. You can find support or learn more at panda.org.au. So I think we'll start off by getting you to tell us a bit about yourself and what you do.
So I'm a neonatal paediatrician. That means I'm a person who's trained as a general paediatrician but who've done extra training to specifically look after babies. So that's all I do. I look after babies in the first 3 to 6 months of life.
Okay. And what is the fourth trimester?
Well, it's a slangy sort of term that people use, really. A pregnancy in humans is divided into 3 trimesters, and people refer to the fourth trimester as that first 3 months of a baby's life. The inference being that actually it would be better if that time was spent with the baby in the womb, maturing such that they were in slightly better shape to deal with the world when they came out. And I think people say that because in most mammals, when the newborn arrives, they're actually much better equipped to deal with the outside world than humans are. And of course, one of the things that humans evolved is a very large brain, and with that goes a large head. And so babies can't really stay in the womb any longer than 9 months. So they're born as late as they possibly can be to come through the birth canal. But then in some respects, you might say they're ill-equipped to deal with those first few months of life.
Okay. So I guess we'll get straight into the questions about that first 3 to 6 months. So how much should a baby be sleeping in the first sort of few weeks of its life?
Well, it's pretty variable, and I think one of the problems with the resources that are available to parents is that quite specific guidelines and expectations are given about what a baby should do. And it can be very anxiety-provoking for parents if they find that their baby is doing something that's a little bit different to what the guidelines or the resources that they found on the internet say. But as a general rule, in the first 2 or 3 weeks of life, babies do very little apart from feed and sleep, and often parents are quite surprised by that. But after 2 or 3 weeks, it's normal for the baby to start to have some more awake time, often after, but it can be before feeding, when they're settled and content, but looking for some interaction with their parents. But in the first 2 or 3 weeks, most babies will be sleeping somewhere between 16 to 18 hours a day. And then once they get beyond 3 or 4 weeks, that would start to reduce a little bit.
Okay. And do you have any tips for establishing good sleeping patterns?
Well, I think most babies really like regularity and routine. That's certainly been my experience professionally, and also from my experience with my own children when they were newborn. I think babies like to have a fixed routine each day, and my experience is that if you deviate a lot from that routine, especially by dragging them around out of the house, out and about, into shopping centres and so on, then that can often upset their routine to the point where they can become quite unsettled. In many cultures, of course, it's routine for the mother to stay indoors for the first 6 weeks and looked after, cared for by her family and friends in a way which really helps establish that good routine. So I think these habits and customs that have been going on for many years in different cultures are actually a pretty good pointer as to what it's a good idea to do when you've got a newborn baby at home.
Okay, and how often should my baby be feeding?
So again, that's quite variable. I would say for most babies in the first 6 weeks of life, they'll be feeding every 3 to 4 hours. And however, there is a bit of variation around that. Some babies will get into a routine of feeding every 90 minutes or 2 hours, and that's fine. Some babies will start to sleep longer at night, quite early, and will start to have 4 or 5 hour sleeps at night, and that's normal too. What matters is that the baby is content and happy and growing well and developing well. And if those conditions are met, then whatever the baby's feeding pattern is fine for that baby.
And how do you know if your baby's hungry?
Well, generally speaking, babies will cry if they're hungry, so they give a pretty good indicator. As a species, babies needed to evolve to have an absolutely fail-safe mechanism of letting their mothers know when they need attention, and especially when they're hungry. So if a baby's really hungry, usually they'll cry. Of course, there can be more subtle signs of a baby being hungry before they actually start to cry, and many mothers will start to pick up on those after the first 2 or 3 weeks. So baby might start mouthing in a particular way, or putting the hand up to the mouth and starting to make movements like they're interested in feeding.
And as with sleeping, is there a routine that your baby should have with feeding?
I think it's quite important to go about the feeding routine in the same way each time. So often mothers will find if they have a particular place in the house that they're going to feed, a particular chair that's really comfortable for them when they're feeding, that can be a really good thing to do. And I think just trying to keep the routine the same each time. Some mothers find it helpful to change the baby's nappy halfway through a feed, especially in the first few weeks. If the baby's a little bit sleepy, might need a bit of stimulation halfway through. So often mothers will stop feeding halfway through the feed, they might burp the baby, change the nappy, and then restart the feed and burp the baby again afterwards. So just a nice simple routine, but which is repeated time after time to get the baby used to that routine.
Yeah. And in the first few months, how will the baby's senses change?
Well, quite a lot. Babies are usually not that reactive in terms of their visual attention in the first week of life. So their eyes will roam and seem to be looking at random things, but usually by the time a baby's 2 or 3 weeks old, they'll be fixing on their mother or father's face. So by that I mean that if you hold the baby 30 centimetres or so away from your face, that's the natural focal length of a baby's lens in the eye. So if you hold a baby 30 centimetres away from your face, by the time they're 2 or 3 weeks old, they'll gaze directly into your eyes. We call that fixing. So that's the first thing that parents notice with a baby's visual attention. Often then by 4 or 5 weeks, a baby will be starting to follow. By that we mean that when the baby is within a metre or so of its parents, when the parents are moving around the room, the baby will actually follow them with their eyes, keeping a close eye on where they're getting to. So there is a little bit of delay after birth in terms of visual attentiveness and visual milestones. Auditory or hearing milestones are quite different. Often we notice even in the first few days of life that a baby will react to noise, either by startling or settling when they hear their mother's voice. Obviously they've been in the womb, so they've been used to their mother's voice for many months. And often babies will immediately settle or react straight away, even in the first few weeks, in the first few days, to their mother's voice.
Okay, great. And when should I start giving a baby tummy time?
I usually say once that very peaceful period in the first 2 or 3 weeks has passed, that's a good time to start to put a baby on their tummy. It can be a really rewarding experience for parents and the baby to start to have that play time, because that's what it really amounts to at the beginning, play time together. I usually say that often babies don't react to it that well to start with, and they often won't tolerate it for more than a couple of minutes at a time. So I usually recommend to mothers to do it several times a day, so 3 or 4 times a day, just for a minute or two to start with, and then as the baby starts to really enjoy it and relax into it, then to build that up. So for several minutes, maybe 7 or 8 times a day.
And what about swaddling? What is swaddling and how can it help?
So babies have a very brisk startle reflex, and by that I mean that in the first 3 months, in response to a sudden noise or a sudden movement or a sudden change in visual stimulus, they will have an uncontrollable impulse for their arms to go up, which is the startle reflex. That is a normal primitive reflex in the first 3 months of life, so it's not a bad thing, but it has the unfortunate effect that if a baby's arms are completely free, if they have a startle reflex in response to some stimulus, they can disturb themselves from sleep. So it can be counterproductive in that respect. So for that reason, we generally recommend that babies should be wrapped with their arms tucked in so that they can't have a very brisk startle reflex. We do think it's important for babies to be able to get their hands to the middle and also to their mouths, because they will help settle themselves without being fed by having that contact with their hands. We know from ultrasound images of the babies in the womb that they often will have their hands in the middle and by their mouth, so that's a very natural posture for them to adopt. And we try and replicate that when a baby's outside the wombs. So I generally recommend to wrap a baby with their elbows tucked in quite tightly so that they can't get their hands up above their head, but with their hands in the middle so they can get near their mouths. So we recommend to start the swaddling by keeping a baby's elbows in but their hands up, and then tucking their arms in nice and tight so they can't get their hands out. So tight at the top.
Yeah.
It's very important, however, that the baby's not tightly swaddled at the bottom. And that's because we know that it's important for a baby's hip development for them to be able to move their hips around, and in particularly to be able to open their hips up. So for that reason, while we recommend that a baby be swaddled tightly at the top, it's really important at the bottom that they're loosely wrapped so that their hips can move around.
Okay, great. And we do have a video on our blog as well if you'd like to see how our midwives swaddle babies. And do you have any tips to help soothe and settle a crying baby?
Yeah, I think this is a really difficult area, and I think it's especially challenging for first-time parents. I think first-time parents often assume that if a baby's crying, then that automatically means that they're hungry and they need to be fed. But babies cry for a whole host of different reasons, quite apart from being hungry. Crying is, of course, how a baby communicates with the outside world, or one of the ways, and so it's quite natural and normal for a baby to cry. It doesn't automatically mean that they need to be fed or indeed picked up or held. They might actually be quite content where they are, but just happy just to vocalise a bit. So you shouldn't automatically just pick up a baby because they're crying. Of course, if they're really, really angry and upset and red in the face, of course it's the natural and right thing to pick them up straight away. But if they're just having a bit of a moan or a whinge, it's fine just to reassure them initially with your voice that you're there for them and nearby. And often that auditory stimulus is all the baby needs to settle. After that, if that's not successful, sometimes giving the baby a visual stimulus that you're there will help. So you can go to the cot side and get in the baby's visual axis so that the baby can see the mother and be reassured that everything's okay. If those simple things don't settle the baby, then often you need to do something with touching the baby. Sometimes just putting your hand on a baby's tummy and again giving them that auditory stimulus with talking will be enough to settle them. Often as well, if that doesn't work, you can grab their hands, bring them together in the midline and gently hold them together. These simple things can sometimes be very effective. However, if all of those simple things, and it's really worthwhile going through that sequence to see if simple interventions will help, if all of those things fail, then you need to pick the baby up and cuddle the baby. And often that by itself is enough. And if all of those things fail, then perhaps the baby's giving you a sign that he or she is hungry and ready to be fed again.
And we just had this one question come through from Facebook. Because my little girl was born at 38 weeks, should I be looking at weekly milestones, for example, lifting head up at 3 weeks as now or from her due date, which was the 5th of November?
So our rule in perinatal care is that if a baby's born before 37 weeks of pregnancy, then we would consider that they're premature. So if a baby's born before 37 weeks, we would usually make a correction to the mother's due date to allow for those few weeks that the baby's come early. And we make that correction when we're making an assessment of their growth and feeding and sleeping and development. If a baby's born after 37 weeks, we don't need to make a correction like that. So the answer to your viewer is that we should start counting the baby's age from the time of birth when we're making an assessment of those things.
Great, and we've just got one more. So my 4-week-old is very gassy and often seems uncomfortable even after passing wind. I'm using Infant's Friend, which helps bring up the gas, but he still seems whingy. Is this just something that will take time whilst his gut is developing, or should I alter my diet or change anything else?
We probably need to explore that a little bit more with the mother, just looking for other symptoms. But I think the most likely thing is that the baby is, as we say in healthcare, fussy. Out in the community, most people call that behaviour though colic or wind. And as the mother suggests in her message, that is a very common thing, and it affects almost all babies to a greater or lesser extent. The usual pattern is that a baby's pretty good for the first couple of weeks and doesn't cry that much unless they're hungry. Once they're 3 or 4 weeks old, they can start to get a bit unsettled, often towards the end of the day, in the afternoon or evening, having periods of time when they seem to have pain in their tummies. So they'll often pull their legs up and strain and arch their back and go red in the face. And they have attacks of this pain lasting for several minutes, which then goes away as quickly as it came. So that sort of behaviour tends to start at 2 or 3 weeks, and it follows a pattern of getting worse and worse, building up to a peak at 6 to 8 weeks. And often by the 6 to 8 week stage, it's not isolated to the end of the day, but will extend throughout the whole day. But one of the really important characteristics is that at night, babies who are colicky or windy or fussy tend to be really quite good, their behaviour at night being very different to how it is during the day. Once it reaches a peak at 6 to 8 weeks, babies seem to turn the corner and it just steadily goes away, and by 3 months, in almost all babies, and occasionally by 4 months, it will have completely settled. There are lots and lots of treatments available to treat that problem because of course parents get at their wits' end with this sort of behaviour. And like your follower has mentioned, there's treatments like Infocol and Infant's Friend and brow colic relief, gripe water, those sort of things. My experience is that often those treatments don't help very much, and what really fixes colic or wind is just the passage of time as it follows that typical pattern, peaking at 6 to 8 weeks and then disappearing by 3 months. So while those treatments are completely safe, and there's certainly no harm in trying them, what usually settles that sort of behaviour is the passage of time. Certainly with your follower and her question, it would be important perhaps for her to talk to her maternal and child health nurse or GP or paediatrician to make sure there are no other underlying problems and perhaps other symptoms which we need to ask about.
Great. Well, thank you so much for your time today, John. I think that's all we've got time for. But I'm sure everyone's so grateful for you sharing your insights about the 4th trimester. If you have any more questions, feel free to get in touch and we'll get back to you. And remember to like us on Facebook to keep up to date with the latest Epworth Live episodes. Thank you.